Good morning, good afternoon, good evening to everyone who's joining us. We'll get started in just a minute. Just want to allow for some time for folks to enter the Zoom room. In the meantime, if you'd like to introduce yourself in the chat, we encourage you to do so. Feel free to share your name and where you're joining us from. Thank you. Great, I think we can go ahead and get started, and hopefully folks will join us in the next few minutes. Welcome again, and Happy New Year to those that are joining us for the first time this year. Before we get started, I just want to provide some logistical information. The first is on interpretation. So if you'd like to experience this webinar in French today, we do encourage you to go to the interpretation button on your Zoom panel and be sure to select French. We're also asking that all of our English-speaking folks also choose which room you want to be in. So if you're English-speaking, please be sure to select the English channel. And that will ensure us to be able to understand our Francophone colleagues. So be sure to do that now, and I'm sure we'll be sending out information in the chat just throughout in case you have any questions there. We're also going to be actively using the chat today, so feel free to enter in your questions or comments throughout. We'll be sure to address them in the chat. If there is some time at the end of the session, we'll kind of answer a few questions there as well, so you'll be able to voice over them if you raise your hand. We're also asking that you rename yourself either and put an E or an F in front of your name to indicate if you're English speaking or French speaking. And that will help us sort you into the right breakout room. So about halfway through the webinar, we're going to have an opportunity to connect in smaller groups and discuss some questions. And that's important so that we put you in the room with Francophone colleagues. So please be sure to do that now. We'll also send some reminders throughout the session. Great, and with that, I want to go ahead and pass it over to Adriana from JSI, who's going to be leading this webinar today on introducing a new immunization service or experience, Immunization Service Experience Toolkit. So over to you, Adriana.
Great. Thanks very much, Liz, and thanks to everyone for joining today from wherever you may be. We're excited to chat about service experience and to share some great new resources that may be of use to you. I'm supported today by a lovely team who you'll get to meet a bit later in breakout groups. Next slide. Great. So for today, we basically have three objectives. We'd like to introduce this concept of service experience, talk about, how does this apply to our immunization work and why is it important? We'd like to walk through some resources in a new toolkit that's been developed and think about how this may be used in your contexts. And then lastly, we'll have a bit of discussion around these issues and think about how we can start to address them. Next slide. Wonderful. So to start off, we have a video that we'd love to share to kind of introduce this concept of immunization service experience. Across lots of other Boost webinars, we've been discussing issues related to demand, And today we're really focusing on how the delivery and experience of care may affect demand and use of services. So let's take a look. I think I'm not hearing the audio.
Immunization saves lives. Dependent on the supply and delivery of vaccines. Yet rates for routine immunization coverage have not reached optimal levels around the world. COVID-19 and immunization inequity show how important it is to focus on confidence, acceptance, trust, and demand for vaccines. Improving the immunization service experience can help. This includes factors at the facility, in the community, and from the broader system that influence the delivery and experience of both a health worker vaccinating their client and the client receiving the service. A person is more likely to trust the health system when their encounter is positive, so the immunization experience should be person-centered. Health workers feel empowered to do their jobs well when they have effective managers and access to sufficient training, supplies, and equipment. The environment at a health facility influences health workers' performance and how people perceive the quality of services they receive. When community members are involved in the design, delivery, and monitoring of services, they foster greater acceptance and accountability. They inform outreach services, which target the hardest to reach communities, especially important in times of crisis when services are disrupted. A variety of community actors and stakeholders support ongoing advocacy, leadership, and sustainable financing for health services, including immunization programs. Improving the immunization service experience strengthens trust and confidence in the health system and increases demand for vaccination. This means healthier and more productive lives for children and their families. Now, on stage of people,
Great. So I think next we'd like to do a quick Zoom poll and hear from all of you. So we'd love to hear what you think about this statement. It's an opinion poll. So I feel that issues related to the service experience have an important effect on how immunization services are delivered in my context. So we'll give just a minute here for everyone to take part in the poll.
And just to confirm that everyone can see the poll. Yep.
Great. So maybe we have a little over half of our participants have taken the poll. So maybe we can close it. Yeah, great. So I think the results are being shared now, right?
Yes, can everyone see them?
So I'm seeing that near unanimous agreement, 96% agree with that statement. one person maybe feels neutral. So wonderful. Let's, I think we can continue to talk through and unpack some of these issues. Great. So, wonderful. So what is the immunization service experience? When we talk about service experience, what do we really mean? So what we mean when we talk about service experience is thinking about all of the factors, both within and beyond the interactions between a health worker and an immunization client, which influences the ultimate delivery and experience of that service. So, there's a lot of different components that can influence service experience. You can see on this diagram some of them, and they're occurring at different levels, and we'll dig into that. All of these components can affect either the client receiving the service or the health worker who's providing the service. And ultimately, that influences whether a positive, person-centered, high-quality immunization service experience occurs. Next slide. So why is service experience important and why now? So, historically, a lot of attention has focused on getting vaccines out, right? The idea that if you supply them, that people will come. But I think we've seen, particularly over the past several years, that is not, that's not enough. COVID-19 and a lot of issues over the past several years have really shown us how important the ideas around trust, around demand, and around quality are, to be able to really encourage uptake and continuous uptake of vaccination services. And so really what we're seeing and feeling is that this is more important than ever. We know that globally coverage has been dropping. It's been the largest backslide in 30 years. And within that context, it's really, really important as we move and look to our IA 2030 goals. And as we're thinking about equity and providing services for all, that we really think about the importance of fostering continued acceptance, confidence, and demand. If you could hit next. Yeah, so if you could go back one. So we really see that fostering this kind of continued acceptance, confidence, and demand are going to be critical if we're going to reach our goals and be able to address all of these emerging challenges that we're seeing within EPI programs. Next slide. Great. So I wanted to take a second to talk about this. This is the Journey to Health and Immunization journey map. And you may or may not have seen this before. This was developed by UNICEF and partners, but really there's a lot going on in this graphic, but really what it does is show the journey for both caregiver and health worker towards immunization. So we have a number of steps here, right? The first being, what is knowledge and awareness and belief around immunization? So for example, for a caregiver, that might mean, what is that practical knowledge that they may or may not have? What are the norms and the values that they have and the trust that they have in the healthcare system or in their provider? For the health worker side, that, it's clear, what does it mean in terms of what are the practical competencies that health workers have? How do they perceive clients? Second is the intent. So when we're thinking about intent to vaccinate from a health worker's perspective, that may look at issues around healthcare worker motivation and satisfaction. You know, how well are they recognized for the things that they do well? And are they respected in their communities? An intent to vaccinate for caregivers may center around issues related to decision-making power. So does, for example, does a mother have, you know, have that ability to make the decision about her child's vaccination, or does it involve other people? You know, whether that might be her husband or, you know, a mother-in-law, et cetera, others within the community who may have that decision-making power. Third is preparation, cost, and effort. So these are all the kind of practical issues around vaccination, of what it takes to, you know, get to the facility and prepare for that service. 4, point of service is, you know, at the moment of vaccination, you know, is this, is the hour convenient for the caregiver? Is it an appropriate location? For on the healthcare worker side, you know, do they have job aids? What's their workload like in the facility and the flow? All of these things affect the experience of care. 5th is the experience of care. So this is that kind of direct interaction. So what does the interpersonal communication look like? Things like that, those types of issues. How is information communicated, or about, you know, pain or other issues, or information about, you know, for example, the use of home-based records. So all of these things relate to the experience of care. And then lastly, after service. So, you know, does a caregiver have information on, you know, who to contact if they have concerns about side effects, or what's, you know, what's normal, what's not, and how are health workers, you know, kind of continually supported on the health worker side as well. So, you know, you can kind of see throughout this whole journey, you know, that there's a lot of factors that obviously that go into a child or a person being immunized. And they're obviously around points 4 and 5, point of service and experience of care. Those really, you know, clearly fall within these ideas around service experience. But you can also see how well before and well after the service, you know, these steps 1, 2, 3, and 6, they also can have an effect on the ultimate, you know, experience of care. Next slide. Great. So, you know, what we see that service experience really plays an important role in establishing trust and confidence in the health system. And that ultimately is a determinant of whether, you know, that there is continual use by clients and caregivers. Next. So a positive experience, next, can contribute to, like we said before, right? Continued, it can contribute to confidence, acceptance, demand, uptake, and that continued use of services. Whereas on the other hand, next, a negative experience, this really could have an effect of sowing mistrust, refusal of services, lack of participation, and this can actually go far beyond immunization services. So, for example, if a caregiver is treated poorly during immunization services, that may have an effect, you know, even, for example, the next time she's pregnant, she may hesitate to go to that facility for ANC services and vice versa. So this can have, we've seen that this can have knock-on effects, you know, beyond immunization services. Next slide. Great. So we're going to dig into some of these key components now around service experience. We won't have time to go into all 13 components, but we'll go through a few to kind of help make this a bit more concrete. All of these components were essentially synthesized out of a qualitative scoping exercise that was conducted in Ghana, Kenya, Mozambique, and Nepal through key informant interviews to really understand what are all of these things that help contribute to a positive, people-centered service experience. And all of these are really interconnected, and they all have an effect on whether there is ultimately, stronger trust, confidence, acceptance, and demand. And maybe one last thing I'll say before we kind of dive in is that, the client is at the center here, and it's often a focus as we seek to improve immunization outcomes. But I think it's important to remember that service experience also affects the delivery and experience for the health worker. So the health worker's ability to provide a positive, high quality immunization service is also strongly affected by the various components in this diagram. Next. Great. So first, we're going to take a look at that kind of individual health worker and client level. Next slide. And we'll look at an example of expectation and perception of service experience. So this is about the factors that influence both client and health workers' interpretation and how they perceive the service. And so for some, it may be outcome based. So, did I do what I needed to do, right? So the health worker thinks, okay, if I've immunized all the children, then my job is done. Or it may be experience-based. So for example, a client may think about more, how they were treated during the interaction. What was the whole experience like? Did they have to travel 2 hours just to get to the site? All of these other factors that may not just be about whether or not their child was immunized in the end. And so there's a lot of issues that go around how is the services being perceived. Next slide. Yeah, so one thing I wanted to touch on here, in addition to this idea that, sometimes it's about that kind of individual interaction, and then sometimes it's about kind of these broader issues. One thing I wanted to turn attention to here is the third bullet around gender issues and barriers. So these may be at play for both clients and health workers, and that really affects how the service may be, how it may be perceived. So, for example, how is for the caregiver side, how is an unmarried woman treated by health workers when she brings her child, right? Depending on cultural and social expectations, there may be different treatment that's given, and that has an effect. On the health worker side, when we think about possible gender issues and barriers that have an effect on how services are perceived, we have to think about and examine how our female health workers supported to be able to work longer hours or evening hours, which may be expected at times for certain vaccination sessions, particularly in urban areas. How does the design of services affect health workers as well, and what their other responsibilities may be as a result of their of gender and social norms that may be in place. And so I think ultimately here, what we want to think about is, obviously we know that interpersonal communication is important during services, and that health workers, also need to be supported as well, so that they are able to carry out their responsibilities. And there are also other kind of issues that can be looked at, things like feedback mechanisms, so that you can understand and align expectations of services between communities and the health system. Next. Next. Great. So next, we're going to look at the integration of immunization within a package of services. Next slide. Great. So this looks at if and how service delivery is really addressing integrated service delivery is really addressing the needs and expectations. There's an important component of quality that needs to be looked at when you're thinking about integrated service delivery. Next slide. So, when we talk about co-delivering immunization and other health services, we know that there are lots of potential pluses, right? So the opportunity is that it may meet client needs more holistically and conveniently. It can save caregivers time, money, effort. These are all good things. However, there is, in some ways, a threat or issues that need to be looked at more closely, and that is that when services are integrated, if this integration occurs without the proper resources being provided, or additional staffing, or attention to how you might need to change, for example, the flow of service delivery within a health facility. If integration is done in that way, then ultimately you may see quality go down. So, it's really important to think about, if you're going to add more services, how might that affect, patient waiting time, health worker workload, et cetera. All of these kinds of issues that may ultimately lead to poor quality and a poor service experience as well. Next slide. So an example we'll look at next is one around workplace community. So when we think about at the community level, this idea of workplace community, so this is more focused on the health worker. And this is really about all of the kind of that ecosystem where health workers are working, their work environment. This can also influence the experience of care. So really enabling a positive work environment that can both foster community, job satisfaction, and have the tools and resources to be able to do their job well is really critical. Next slide. And I won't spend too much time on this as I know we want to get some discussion in, but there's a lot of different ways to think about workplace community, right? So you can cultivate this in a number of ways. And obviously supportive supervision is key to be able to both support exchange if it's done in a way that uses mentorship and focuses on sharing and trust between health worker and supervisor. And that can be a really important way to kind of build a sense of community and confidence at the workplace. But we also know that approaches like peer learning, interactive learning, even, for example, communities of practice like Boost, where we are now, all of these things can help that exchange and flow happen and really create a vibrant workplace community. And all of these approaches can help towards health workers feeling both supported and empowered with more job satisfaction and resources to be able to improve their performance. Next slide. Great. And then the last thing that the last example that we'll look at is at that kind of system level. And this one is around logistics and operational resources. And so, I think this one is quite clear that the basic availability of a reliable supply of vaccines, for example, and operational resources, it has an effect on the experience for health workers and for clients and caregivers, right? So you can see in the photo this vaccine out of stock sign. That is obviously, for example, a caregiver that has, traveled to the site, and then to understand that there's a stock out, that has an immediate effect on how their, a poor experience of care. And it frustrates health workers as well. Next slide. Great. And then maybe, in addition to the logistics, just to say, a bit more around operational resources. It's not just about having vaccines, but we know that those financial resources and all those operational costs that have to happen all the way to the last kilometer are critical, right? So not having enough funds to fill the motorbike with gasoline to do that might mean that, the outreach session gets canceled. And so all of these kind of issues, very, upstream within the system, it can have a really foundational impact and negative implications across the entire program, but particularly also with service experience. Next slide. Great. So what do we do about this, right? So what we have recently developed is an immunization service experience toolkit. So this is really designed to offer an orientation on service experience, to kind of unpack some of the issues that I've been talking about today, and to really help spark discussion at a country level around how service experience may be able to be improved at the country level. Next. Yeah, so we really see the users of this toolkit being you all. So really looking at, the managers and the staff at kind of at various levels, at national level, at regional level, and really at any level, to kind of think about how might you be able to address some of these issues within your context. Next slide. So the toolkit has 5 products. The idea is that they can be used individually, but they can also be thought of as a package. And really and truly, one of the most important things here is that they're meant to be adapted. So the idea is that, there's a kind of core set of information here, but really what we want is for people to take it and adapt it and make it their own. Because this is something that we know is so specific to each and every country context. Next. And next. Great. So these products basically can be used at country level to do 3 things. The first thing is to be able to orient everyone. So to be able to really build that shared understanding of service experience and why it's important, and really kind of kickstart that advocacy. So this gives you a set of tools to be able to orient your coworkers, your supervisors, etc. Next. Yes, and then the next piece of it is it's meant to generate discussion, right? So that you can discuss, well, there's a lot of different components that affect service experience. What are the really specific ones that are having an outsized negative impact, maybe, and that we can really think about focusing our efforts there? Or maybe where are we, really learning about some other area that we could kind of apply that to, maybe in the HIV program in your country, they're really doing a lot of work around around service integration, for example, and what can we learn from that, right? So thinking about both where are the issues and where do we need to focus our energy, but also where can we learn from. Next. And the third thing that this toolkit will do is help provide some guidance around planning, so that as you're going through this process, you can think about developing, a priority action plan on where you can improve. And we have some complementary tools that we'll go through about this. And the idea is that this planning should be integrated into your overall health sector planning for immunization. Next. Great. So I'm going to take just a couple of minutes to do a bit of a walkthrough so you can understand and see this toolkit in action. So I'm going to share my screen. And let me just 1 second. Great. Great. So we'll share the link to where to find the toolkit. It's on our Demand Hub website. But basically, when you come to the service experience page, you'll see a bit of explanation around service experience. And then if you keep scrolling down, here's where we get to our toolkit. So we have the entire toolkit, which is available both in English and in French. So all products are available in both languages. And so you have buttons here to download the complete toolkit. This will download as a zip file. And then if you keep scrolling down, you'll see these are the 5 products that we have. So this getting started, and again, each of these has a download button in each language. So for example, this getting started guide, this is really where you should start. So this is really kind of a short reference guide. If you're excited about service experience and want to improve it, this is the place to start, because this can kind of give you a guide to how you might use all of the other products and what process overall to be able to take. And I'll say it's we tried to keep it brief, so it's not too many pages and not too text heavy. So we really want this to be something that's doable, not something that takes you forever just to get started. So that's where you would start. We have the video which you saw earlier today. That can be shown. We also have that in multiple languages as well through subtitles. We do have a 2-page fact sheet. This can be really helpful, particularly at that orientation stages, and to really just use as a quick reference. It essentially, I'll show just real quickly, it has kind of the definition, why does this matter? And then it kind of unpacks the definition of each of these factors. So just a kind of quick reference. Now here we have an orientation presentation. This is a PowerPoint presentation that's orientation on this. This is totally customizable. So it has some of that content in there, and I'll show you just quickly some of the content that we looked at today. But the idea is that you should be adding, information from your own country context and really bringing in examples that that speak to what's happening in your context. So it has lots of this information and goes through all of the kind of examples in depth. It's designed as a 1-hour session. And then lastly, we have discussion questions. So these discussion questions, these are really meant to, once you've kind of done this orientation, you've engaged all of your key stakeholders. And again, in the Getting Started guide, there's some guidance around different types of stakeholders that you may want to engage at country level in this process. So once you've done all of that, really what we would like to do is ensure that there's some specific discussion that's generated around, what are the issues in your context. So these discussion questions are, really just, again, meant to be changed and adapted to your needs. The idea being that, this could take place in a number of ways. So you may decide to have a small working group that kind of looks at these discussion questions in more detail and then reports back to maybe your technical working group. Or you may think about doing this as part of a workshop and have it be, kind of participatory and in the moment. So there's a number of ways, and we give some ideas around how you might kind of structure this discussion. But the idea being that you want to understand some of the issues related to what's going on in your context, right? So, thinking about, is there already a national policy or guidelines around person-centered care? And if so, do they talk about immunization at all, or is it just kind of more broadly? Issues like this. So there's a number of kind of questions. And again, the idea is that, this could be changed. This could be put into a PowerPoint and be part of a workshop, or maybe this could be something that, like I said, like a working group takes on. There's different ways to think about it depending on what you think makes sense for your context. So I'm going to leave it at that for now. Maybe let's go back to, I'll stop sharing. Let's go back just quickly to the PowerPoint. Wonderful. Okay. And so, yes. So then once you've kind of discussed, right, then, what we want to do is get to the planning stage, right? So the toolkit does give some kind of overall basic guidance. The idea being that you should be, having this planning fit into a broader process that's already existing within your country at your level. And then I wanted to share kind of a complementary tool that can also be really helpful at that planning stage. So this is a WHO Quality Immunization Services Planning Guide. And so this is really this is a great resource, and that highlights kind of the practical steps that you can take and thinking about the planning in order to improve, kind of quality and delivery of services. So we'll be sharing this resource as well. And this is just kind of a nice complement to the overall toolkit as well. Next slide. Yes, and I think just for time, we'll move on to the next one. Yeah. And then, I think we also don't have too much time to get into it today. I want to make sure that we have time for discussion, but I wanted to flag a couple more helpful resources. These can be really helpful in improving service and experience, and then also thinking about strategies to improve demand and uptake more broadly. So we have the behavioral and social drivers of vaccination, BEST, tools, and as well as practical guidance. And then on the right, we have HCD tips, so human-centered design for tailoring immunization programs. And that really kind of gives guidance and direction on using human-centered design throughout this process. And so we'll be sharing links to all of this at the end as well. And great, next slide. So yeah, so I just wanted to maybe have I think maybe just because of time, maybe we should go straight to breakout groups, unless there's any kind of technical questions, but we'll be sharing all links to everything at the end. Yeah, maybe.
Great, so I guess we can move into breakout rooms. So I've sorted everyone, and in just a minute, you will get a pop-up.
Yes.
So just be sure to join your group, and then we'll probably come back in the next 10 minutes. Does that sound good? 8 to 10 minutes?
Yeah, can you just go to the next slide just so I can quickly give a very super quick introduction. So we're going to have 5 groups today. I'm going to be joined by Catherine Bagshaw, Francine, Leela, and Lisa. So you'll be in a group with one of us, and all of our the colleagues that I have with me today, both are from JSI, but also from the Demand Hub, which is a global working group. And so we have colleagues, we're happy to have colleagues from USAID, WHO, and other organizations where we've been working on this kind of stream of work collaboratively. Great. So you'll get to know one of our facilitators soon, and we're going to have just maybe 8 minutes or so, since we're short on time. Is that all right? Or yeah, maybe 6 or 7 minutes. And we'll be discussing these questions.
Great, I will go ahead and open the rooms.
Hi, everyone. Welcome back. I'm sorry, I think I'm hoping that not too much discussion was cut off. I know in our group we were having some good discussion, but we do have at least a few minutes here, so maybe we can have some of this discussion continue in plenary. Let me start by having each group present out just 30 seconds of your kind of what your discussion looked like. Why don't I start with Lisa, your group?
Sure, yes, thank you. We did get caught off a bit, but we were talking really about how much infodemic management and communication is so important now, and really influences the way communities are thinking about and engaging with the health system, and really building that community confidence in the health system. So that was a lot of what we talked about. So I'll pass it back.
Great. How about we go to Kate?
Yeah, thanks everybody.
Okay.
I just wanted to say actually that we were talking about the same thing that Lisa said, just sort of the importance of this community in the community input, understanding sort of how they're feeling about vaccination, about the health system as a whole, to sort of build some of that trust and confidence, because the experience now, at least in the context that we were talking about, is a bit riddled with some fear associated with sort of disinformation, misinformation, and sort of information gaps. And so it's important to strengthen those community ties and conversation and that input to make sure that the system is able to respond to those needs and those questions. Over.
Great. Let me go to Francine.
Yes, unfortunately, because of some technical issues, we didn't get a whole lot of time for discussion, but we did start to touch on how the logistical and supply side of things also really impacts on demand. So a little bit what you had also talked us through, Adriana, in your presentation about, at the very least, the services do need to be there. The vaccine needs to be there because when they're not, it results in loss of confidence in services. So that interlinkage between supply and demand was something that we started to explore as well.
Great. And Leela?
Yes, we definitely had a very short time, as other colleagues have said, but we started discussion with the workplace, especially working environment for the health worker, and that determine the quality of services, especially low paid, and challenges of the transportations and less community participation, and whole range of challenges from the service provider perspective. that also affect the demand of the services. That was kind of discussion we had in our team.
Great. And maybe lastly for my group, Dr. Adefunke, do you want to come in?
Yeah, thank you so much. Just like the first and second, third, and partially the last speaker I've just said, I think the main bone of contention is about distrust, because what everyone is just trying to do now virtually across the globe is to integrate COVID, immunization, vaccination into the concept, component of the schedule of the immunization across board. But we discovered that people still, feel uncomfortable. They still feel distrust in taking this vaccine because of what? These are the myths, misconception, misleading, either directly or indirectly. And Adriana really suggested that, fine, part of those things that we should do is to get our our infodemic component aspect of these services be well established. It's not only just about the risk communication, it entails every other things. And I think at a point when Adriana was presenting, I wanted to say that probably because I've not really gone through the main toolkit, this kit, probably I could have found out where infodemic were really established, because this is at the area everyone needs to work on, because immediately we can get the buy-in, the trust of these community people, probably get them engaged more than before, we can usually sort ourselves. I think this is one of the core areas we need to look at, and that's what exactly we discussed in our group. Thank you.
Great, thank you so much. And thanks to everyone. And apologies that we've run a bit short on time, but hopefully, maybe we can continue the conversation over the Boost platform. I think, this issue of the context of infodemic and distrust in the health system, I think really lends itself to, not just, I guess getting people into services and having them demand and use those services. I think you may need to look at some of these kind of community level issues here in teal on the top left, right? So how do community actors and stakeholders that may be trusted messengers, how can they be leveraged for that? And then how can that be reinforced at the health facility? So in that interaction between health worker and client, how is the health worker equipped to be able to answer some of those questions that, maybe someone saw in a post somewhere, right? So just for the interest of time, I just wanted to kind of quickly summarize that, this idea that we know that it's an important part of both establishing and maintaining confidence, acceptance, trust, and demand for vaccination. But I do want to emphasize that, addressing service experience does not have to be kind of this really daunting thing or something that's going to take a ton of resources. I think it's really about shifting a perspective to look at your program through a lens of service experience. So it's a way to kind of think about all of the things that are going on in your program and ways that you can kind of tweak and adjust what's happening. Next slide. Great. So we have a couple of next steps. I know we're over time, so I want to let everyone go. We'll share all of the links for everything. On the right-hand side, I did want to just kind of invite all of you to keep connecting with us. So we do have a kind of quarterly email. We have an email list that you can join for kind of quarterly calls where we do talk about service experience and exchange kind of different country experiences. We can share the link for that. And then if you have questions or if you want to start using the toolkit, we'd love to hear your feedback. My email is here. We'll also include a post-webinar survey where you can get more information. And maybe we can talk with Liz about kind of setting up an offline, maybe a learning group or something to be able to kind of keep connecting on this topic.
Great. Thanks so much, Adriana, and to the rest of the JSI team. Like you said, I will be sending out these links in a follow-up email along with the recording and slides, and also the French recording and slides as well. So stay tuned for that. We also just have a quick survey. When you close out of your Zoom panel, you'll see it pop up. If you wouldn't mind taking that, that would be super helpful as well. But just wanted to thank everyone for their time today. And yes, looking forward to continuing the discussion on the Boost community platform. And we can definitely set up some space to chat about this toolkit. So thanks so much again. And have a great day, everyone.
Thank you very much.
Thanks, everyone.
Thank you.
Merci beaucoup.
Thank you.
Ciao.
Thank you.